Nobody wants to receive bad news, especially when it comes to health. But if you do feel like there's something wrong, it's important you speak to the doctor about it. The earlier, the better. It's a simple message, but it's so important, especially when it comes to the pancreas. CEO of Pancreatic Cancer Action UK, Ali Stunt, is celebrating her 12th year as a pancreatic cancer survivor, proving the disease is not always the death sentence it's often considered to be.
Well, I'm following up on a trip I made last year, and I gave a talk to the DHA and also here at the Cancer Relief Centre to raise the profile of pancreatic cancer and also to give some knowledge about some of the pathways and some of the nice guidelines that we've got in the UK for pancreatic cancer, and also to make some of the clinicians aware of some of the new developments that have been happening for the disease since I was here last.
I know pancreatic cancer is a disease that's often diagnosed quite late and can often be fatal. What kind of symptoms should people look out for?
Well, one of the key symptoms is abdominal pain. So you get tummy pain that is sort of in the middle, going round to the back. Some people suffer from back pain. I'm going to show you where that is because it's up here where a lady's bra strap sits, and that can radiate round to the front as well. A lot of people will suffer weight loss unintentionally, and if you're losing weight without trying, then that is a symptom that you need to take to your GP. We have people who will develop jaundice, and that will cause a yellowing of the skin and the whites of the eyes. Could turn your urine a darker colour, bit like builder's tea, and sometimes people can get itching with that jaundice as well. Change in bowel habit can be quite common. We get diarrhea symptoms, and we also have something which is known as steatorrhea, which is when your stools are very pale, smelly, floaty, and don't flush away very easily. And basically, the premise is if you have symptoms that are not normal for you and they're new onset, go to your doctor. If you have already been to your doctor and your symptoms are persisting or maybe getting worse, go back and keep going back until you get a referral to find out what's wrong with you.
My father was the kind of man who didn't like going to the doctor and would avoid dealing with serious things. He'd been having stomach problems, was losing weight, and being a man who loved his food, had totally gone off eating. Things I now know are symptoms of pancreatic cancer. He was diagnosed with the disease in March 2014 and he died less than 4 months later. He would have been 63 tomorrow, and I wish that he was here to celebrate with. It's too late for him, but it's not too late for you. You know your body. If you're worried there's something wrong, get it checked out.